Well, Blackford County is a hotspot in Indiana's opioid epidemic. The overdose death rate in the rural area north of Muncie was double the state's average during the peak of the opioid misuse in Indiana. Two of the biggest names in Indiana are now combining forces, though, to help. Business of Health reporter KYLIE VELETA has more. KYLIE.
Thank you, Gary. Two of the state's largest organizations, Purdue University and Indiana University Health, are spearheading a new effort in Blackford and Jay Counties. Purdue landed a $1 million federal grant to lead a new local effort called the Consortium for Opioids Response Engagement East Central Indiana, or CORE-ECI. It's dedicated to battling substance abuse locally, an even more critical effort after the isolation and economic impacts of COVID. And joining me now to tell us more about the project is Dave Hyatt, president of IU Health Blackford Hospital, and Melanie Cline, director of Purdue Healthcare Advisors. Thank you both for being on the show today.
Thank you.
Yeah, thank you.
Dave, let's start with you. These areas are just northeast of Muncie, very rural areas. Talk about the need for this project in this area in particular.
Sure. When we think about Jay and Blackford counties, both are very rural areas, small populations, but as you heard from Gary, they've been dramatically impacted by the opioid epidemic. We are health professional shortage areas, which means that based on our population, we don't have enough healthcare access for our population. So while we try to provide that access, we do have some gaps, especially in that behavioral health. But what's unique to us is we have two counties right next to each other, both with IU Health hospitals, IU Health Blackford and IU Health Jay. And thanks to Purdue, we also have Purdue Extension offices in each county, which have really made this a great opportunity to work collaborative, not just in our own communities, but across county lines, because we are a region and we aren't islands.
And you mentioned that collaboration, 7 community organizations involved. Of course, we don't have time to name them all. Melanie, explain big picture. What is everyone working together to do? Tell us some of the things that the consortium is doing right now.
So yes, the consortium is working across sectoral groups with the goal of collaborating and really lifting up both communities in relationship to prevention, treatment, and recovery for substance use disorder.
And Dave, you mentioned off camera, a big part of this is reducing the stigma. And Melanie, I'm sure you can comment on that too. And also really combining forces within the community. Can you give us just a little more detail about those two things, Dave?
Yeah, absolutely. You know, when we think about substance abuse recovery, you know, it's not going to be solved by any one organization. We can't legislate ourselves out of this problem. It's not up to law enforcement alone to solve this problem. And we as a healthcare system can't solve it on our own. So the thing that this grant's going to help us do is to bring different community players together so that we can all take a look and be honest with ourselves about this problem that we're all facing and we're all affected by, because it affects every walk of life. When you come to these communities, not a single person hasn't been affected by this epidemic. So when we think about the first steps with that, it's coming together as a group, but we have to reduce the stigma associated with substance abuse. You know, there's not a stigma around diabetes or other healthcare conditions, and we have to treat substance abuse disorders just like those others. Because if people have these issues, it's hard enough to get to a point where you want to seek treatment, but we've got to make sure that these people don't feel that they're threatened by their community. We want to make sure that access to care is easy to get, because without that and without the community support, we're never going to make a dent in this problem.
And Melanie, opioids is in the name of this consortium, but you mentioned the drug problem is actually shifting away from opioids in that area now. You say it's more about the underlying causes of addiction issues. Can you share your perspective about that?
Sure. You know, I've worked in East Central Indiana for the last couple of years on the substance use challenges. And, you know, when we embarked on the work, it was really funded around opiates. And what we now know, as we've gotten into the community for a couple months, that the problem has moved to methamphetamine. And so frankly, chasing the drug or the type of substance is not going to really help us to address the issue. So we're really looking at the underlying causes for why there are addiction issues, and we really want to focus our efforts on that, because we believe that that's going to be the sustainable opportunity we have to make a meaningful impact on the problem.
And when you say underlying issues, you mean like health disparities in the community, correct?
Underlying issues around stress, poverty, child abuse, generally, addiction problems it's a problem of childhood, starts in childhood. And so we really want to look at all the underlying causes for what the family stress is impacting on the child's development and the family, and really look to ways to intervene and interrupt those cycles of addiction that are so common across the country, but particularly we're seeing that in our rural communities.
Dave, just a few seconds left, but I think most people don't think of Purdue and IU Health as rural organizations, but you say both of these places really have a rural presence in Indiana, right?
Oh, absolutely, KYLIE. When you think about IU Health or Purdue, we're two of the largest organizations in this state, and a lot of people think that's Indianapolis and West Lafayette, but IU Health is one of the largest providers of rural health care to Hoosiers, and it's in our mission to make Indiana one of the healthiest states, and that starts in our rural areas and improving access to care. And we're so excited, I didn't know it until a couple of years ago that Purdue's got a location in every county in Indiana. So they're a perfect partner for us in this rural work. And we're just absolutely excited to work together on this as two of the great big organizations in the state of Indiana.
All right, Dave with IU Health and Melanie with Purdue, thank you both for being on the show today, and best of luck with the consortium.
Happy to. Thank you, KYLIE.
Thank you.
Gary, back to you.